we start by pushing on NbN 2, and then you see that you get all this line there. You get name, you get type your search, name, pharmacology, mode of action, approved indication, efficacy and side effect, former terminology, and so on. Let's say we'd like to focus on medication that work for OCD. So we push on approve indication, and then we type OCD. So now we are getting all the medication that work on OCD. Let's say we touch on one of them as citalopram, and then you get the pharmacology, mode of action, indication, and since we are focusing on OCD, you see that it's in different color, and then you see the efficacy, you see some of the side effect, and then you see in the practical note referring to QT interval prolongation, and then in the practical note you see also the recommendation, the dose recommendation. There is also a layer about pregnancy, and if you touch upon the neurobiology, you get the neurobiology of the medication, moving on from preclinical to clinical. As was mentioned, you see that there is this sweep to the left. You can look for similar medication in this regard, and then you can choose from the similar medication which medication you would like to choose. So this is a very basic way to look at this. At least you know what is recommended. If we would like to see the same in children, we are moving now to child and adolescent, and again we are pushing on approve indication there, and we see for children what are the approved medication for OCD, and you see all these medication are approved for children. So you can know what is approved and what is not approved, and again you push on this medication. Let's say you push on fluoxetine, and then you do the sweep to the left, and you see other medication that have the same pharmacology. Some of them approved, some of them don't approve, but the approval is, as I mentioned, is not necessarily related to our knowledge about this. It's related to the interest of the pharmaceutical company, so you can choose among the medication that fits the case the best. So this is one thing, and we can now move back to NbN 2, and then we can do other search. Let's say we'd like to see what medication are approved for PTSD. So again, you push on approve indication, and then you type PTSD, and then you see the medications that are approved for PTSD. Again, it doesn't include all the serotonergic medication, because only some of the pharmaceutical companies, only some of the medication did studies in PTSD, but not all the medication, but at least you know which medication are approved or not approved. So this is, and so you can play with this. This is very basic way how to use NbN. So let's say we got a patient with depression that doesn't want to take serotonergic medication anymore because of the sexual side effect, and would like to get better sleep. This is the patient that we are seeing. Which medication would you prescribe for this patient? Depressed patient, don't tolerate sexual side effect, and would like to get better sleep. So you can use the search engine and find out what is the best medication for this patient. Let's do it together. So we're talking about depression. Why it is not? The depression, so I type here on blue, depression. So basically now I get all the list of medication that work for depression. But as I mentioned, the patients suffer from sexual side effects due to the serotonergic medication. So what we'd like now to do is to see if we can give him noradrenergic medication. So what we are doing, we are pushing on add search axis. So we push there, and then we push on pharmacology, and we push on norepinephrine. So now what we are getting is medication that work for depression via noradrenergic system. But as you remember, the patient also complained about sleep. So we are going back on add search axis, and then we are pushing on efficacy and side effect, typing promote sleep. So now we are zeroing down on medication that work for depression via noradrenergic system and promote sleep. But as you remember, the issue that one of the issues that the patient come was about sexual dysfunction. So we'd like to choose medication for depression that is not interfering or have minimum effect on sexual dysfunction. So what we are doing again, we push on search axis and type again and push on efficacy and side effect and type sexual dysfunction. You see sexual dysfunction low. So now we are zero down on 3 medications for the patient that we are seeing in the office that help us to zero down on medication for depression that promotes sleep and has very low sexual dysfunction. Let's say that we would like to look at one of these medications, mirtazapine, so we push and then we go back to the basic issue of NbN, the pharmacological domain, the mode of action. You see the indication. You see that in the efficacy, it's promote sleep. And if you look at the practical note, you see low level of sexual dysfunction. And then while we switch to the left, we see other medication with similar type of pharmacology and mode of action. And then you can, of course, choose other medication. Let me give you another example how to use it. And in this regard, we are going to move, let's say, to the child. So we are moving now to children. Let's say that we are seeing a children now. And the children come and complain, and the main complaint is ADHD. So what we do, we type ADHD. So we basically get the medication that related to ADHD. Another complaint of the parents is aggressive behavior. So we again touch upon add search axis on efficacy and side effect, and we type aggressive behavior. So you get medication that work for ADHD and aggressive behavior. This individual child also have autistic spectrum, so we'd like to get medication that work for ADHD with aggressive behavior and in the autistic spectrum, again pushing on add search axis, typing autistic spectrum, and we get these 2 medications. But as we are looking at this child, we realize that there are tics also. So we'd like to, again, to personalize the medication and make sure that we can deal with the tics too. So again, we are going back to add search axis, push on efficacy and side effect, and types tics. So now we zero down on medication that work for children with ADHD, aggressive behavior, autistic spectrum with tic. We touch on this medication and we see all of this issue there. Again, in the practical note, we see that there is some recommendation, some point about how to use the medication, and there are some recommendations regarding the dose. Just before I finish, let me give you another example. We are switching back to NbN and adult. And let's say we are looking at one of the medications that we many times use in case of panic. And let's say that we'd like to look at one of the benzodiazepam. And then we look at this. And then in the practical note, we got something that I think help us to understand better in the practical note. And Sweden, many different benzodiazepine receptor agonists are licensed worldwide, some in most countries, some only one or two. They all act in the same way and designed only and designated only by pharmacokinetic and so on. So basically give us very important clues regarding pharmacokinetics properties. Let me point out to you what is one of the most important part of this. You push there, and then you get, what I was talking, the 10 pharmacological domain and 9 mode of action. But what is very important for us is this part, send feedback. We know that we don't have the perfect product, and we'd like to get feedback from all of you in order to improve it and to make it more useful. Thank you for your attention.